Hello guys, welcome back to my channel Start Life with Physio. So today our topic is cranial nerve examination. Uh, Quickly like and subscribe to my channel Start Life with Physio. If you are a BPT student, it will be very helpful for you. Let's quickly begin with the topic cranial nerve examination. So we have 12 pairs of cranial nerve, and few of these nerves are sensory and few of these are purely motor, and few of these are both sensory and motor, which are called as mixed nerve. So let's begin. We have 12 pairs of cranial nerve. Let's quickly know the nerves in order before studying each one of them in detail. The first cranial nerve is the olfactory nerve. The second cranial nerve is the optic nerve. Third cranial nerve is the oculomotor nerve. Fourth, we have the trochlear nerve. Fifth, we have the trigeminal nerve. Sixth, we have the obducent nerve. Seventh cranial nerve is the facial nerve. Eighth cranial nerve is the vestibulocochlear nerve. Ninth cranial nerve is the glossopharyngeal nerve. 10th cranial nerve is the vagus nerve. 11th is the accessory nerve or the spinal accessory nerve. And the 12th, we have the hypoglossal nerve. So these are the 12 pairs of the cranial nerves which are present. We can remember the names of these nerves in order. It is going to be very helpful for us to understand each of these. So let's quickly understand which of these are purely sensory and which of these are purely motor. Sensory, we have the olfactory, optic and the vestibulocochlear nerve is purely sensory in nature, and trigeminal, facial, glossopharyngeal and the vagus nerve is purely mixed in nature. Rest are the motor. So let's understand the olfactory nerve. Olfactory nerve is a purely sensory nerve in nature which is responsible for the sense of smell. It is the only cranial nerve whose fibers reach directly to the cerebral cortex without relying through the thalamus. Root, the olfactory nerve terminates at the olfactory bulb, which is located just above the ethmoid bone and below the frontal lobe. The olfactory bulb acts as a relay center for the transmission of impulses from the olfactory nerve to the olfactory tract and then to the cerebral cortex. Let's understand the pathway of the olfactory nerve. First, we have the olfactory epithelium, then we have the olfactory nerve, olfactory bulb, olfactory tract, and the olfactory cortex. Functions of the olfactory nerve. Olfactory nerve carries the sensation of smell from the nasal mucosa to the olfactory bulb. The stimulus then travels to the primary and the secondary olfactory cortex. So basically we have two cortex, which are the primary olfactory cortex and the secondary olfactory cortex. The primary olfactory cortex function is to identify and to recognize the odor or the smell. Okay, and the secondary or olfactory cortex function is to appreciation and discrimination of the odor. Okay, so these are the function of the cortex which are present. Then comes the part of examination of the nerve. The purpose of doing examination or testing the olfactory nerve is basically to understand if there is any olfactory impairment, and if there is any impairment, if it is unilateral or bilateral, which is it is on one side or both the sides, then what is the cause of the impairment. This is the purpose of doing the examination. We commonly use the method of smell identification test, and yeah, let's quickly go in. Method of testing for the procedure. First thing is that make the patient comfortably sit in a relaxed position. Ask the patient to compress one nostril and take a deep breath as far as possible so that we clear the airway. Then repeat it on the other side as well. Now instruct the patient to close the eyes. Now here comes the test, where the test odor is placed under one nostril while other is compressed or closed, and the patient is then asked to take 2 good sniffs. So basically you are making the patient sit in a relaxed position, asking the patient to close the eyes, close one of the nostrils of the patient, then ask the patient to smell the product or the testing odor which is placed under the nose of the patient. After doing this, we have to ask the following questions to the patient first, and after making the patient smell, we need to ask if they can smell anything, and if they say yes, then we should ask what is the type of odor, and they need to identify the odor. Test is repeated in other nostril as well, and we need to ask if they can smell in both the nostrils, and was the smell same. Now here comes the main part. It is that we need to make sure that the patient is previously been exposed to the smells which are being used in during the process of the examination. For example, if you are using the vanilla extract as smell, then we need to make sure that the patient is aware about the smell of the vanilla. And also we need to make sure that we are not using any strong smells that can irritate the patient. Usually for this tests and examination of the olfactory nerve, we commonly use vanilla extract, elaichi powder, or we can also use coffee powder. So this is the way, as I explained earlier, this is the method how we examine. One nostril is closed and the other nostril is let open, and examination is performed. The patient is sitting with closed eyes, and the patient is asked to take 2 good sniffs. Interpretation of result. The result of the examination varies according to the response of the patient. Patient who identify and name the odor quickly, identify but cannot name them, and those who can detect smell but cannot recognize or name them falls into the normal category. Patient who can smell but is deteriorated and unpleasant can be categorized into parosmia. Patient who cannot detect the smell at all are classified as anosmia. And if they have decreased ability to detect smell, it is classified into hypoosmia. And if they have increased sensitivity to any kind of smell, they are categorized into classification of hyperosmia. So these are the classifications which are made based on the result or interpretation, that is parosmia, anosmia, no smell; hypoosmia, decreased ability; and hyperosmia, increased sensitivity to the smell. As I mentioned earlier, precautions need to be taken. As I told, any odor which is being inhaled should be very mild, and it should not be any strong substances. We can use non-irritating olfactory stimuli like vanilla, coffee, or soap, which is relevant to the patient, should be used, and it should not irritate the olfactory epithelium at all. Tests should not be repeated multiple times, as it can lead to vague or variable results. So here comes to an end of the olfactory nerve examination. Like and subscribe to the channel Start Life with Physio, and for further nerves and further cranial nerve explanations, please follow the channel, and please go through the other videos. Thank you so much.